Okay, so we're ProCare Pharmacy and we specialize in diabetes and diabetic supplies. So what exactly is diabetes? To understand how diabetes works, we have to understand how the body works. So when you eat food, it breaks it down into three basic things: proteins, fats, and sugars. Now we're dealing with diabetes, so we're going to focus on sugar. Now, why does the body need sugar? To get energy. Our body is made of trillions of cells, living, breathing cells. In order to feed these cells, the sugar has to go inside the cell. You can't just have the sugar floating around. It needs to go inside the cell or else the cell starves. So your body can be swimming in sugar, but if it's not getting into the cell, your cell starves. And if the cell starves long enough, it dies. So you see food being broken down into carbohydrates, fats, and proteins. The most of the metabolism is based on glucose, which is a sugar, which is a carbohydrate. Here are the different types of cells. You see a brain cell, blood cell, heart cell, any kind of cell. All cells need energy. They need food, which is basically glucose. So this is what we're diagramming here. Skin cell, heart cell, brain cell, blood cell, liver cell, they all need glucose. The glucose has to go inside the cell for the cell to eat. If the glucose stays outside the cell is going to die. Basically, you need to feed the cell with glucose. So, how does glucose get into the cell? When you first start eating food, the very act of eating food gets the body going, saying, hey, I'm eating food. So one of the most important organs that becomes activated when you eat food is the pancreas. The pancreas is going to release a lot of things to help process all this food. And one of the things the pancreas releases is insulin. So when you eat a meal, it's going to get broken down, and then glucose is going to be released into the bloodstream. You're going to have a lot of glucose right after you eat a meal. So glucose is sugar again. So the pancreas is going to see all this glucose in the blood. It's going to start to release insulin. Now, insulin, what's the purpose of insulin? Now, the insulin's role is we have to get glucose into the cell for the cell to eat. Now, the role of insulin is this. On the outside of a cell is a receptor called an insulin receptor. Now, when insulin binds to this insulin receptor, now remember, insulin is a protein, it's a hormone that gets released from the pancreas. So when this protein binds to the insulin receptor, it tells the cell to open up a channel so that glucose can come into the cell. Now, remember, you need to get glucose into the cell for the cell to eat. Now, so if you don't have insulin binding to this insulin receptor, the channel doesn't open. And if the channel doesn't open, glucose can't get in. That's why insulin is important. Insulin is how the cell eats the glucose. By insulin binding the insulin receptor, the glucose can get into the cell. Now, when we talk about the different types of diabetes, now everything will start to make sense. Remember, we need insulin in order for the glucose to get into the cell. So there's three types of diabetes we're going to cover: type 1 diabetes, type 2 diabetes, and gestational diabetes. Now, most of the patients that have diabetes are going to have type 2. 90% of diabetes patients are type 2 diabetes. Now, type 1 is, okay, so now remember, in diabetes, the blood is high levels of sugar. This is hyperglycemia. So why is the glucose high? Because for some reason, something's wrong with the insulin, or there's not enough insulin. So remember, you need insulin in order for glucose to get into the cell. No insulin or defective insulin, glucose can't get into the cell. So type 1 diabetes, your body makes very little insulin or no insulin. Now remember, without insulin, the sugar can't get into the cell, so the cell starves. And that's why type 1 diabetic patients need to take insulin shots. Remember, insulin needs to bind the insulin receptor, and these receptors are on the outside of the cell. And if the insulin doesn't bind the receptor, glucose can't get in because the channel doesn't open without the insulin binding. So the glucose is just going to bounce off the cell and keep going. The cell starves because the sugar is not getting into the cell. Now, type 2 diabetes is a little bit different. Type 2 is something is wrong with insulin. It could be something wrong with the insulin receptor. So if something's wrong with the insulin receptor, the insulin can't bind. And if the insulin can't bind, the glucose channel doesn't open and the glucose can't go into the cell. It could also be something is wrong with the insulin itself. And if something is wrong with the insulin, it can't bind to the receptor and the glucose channel won't open and the glucose can't go into the cell. So the bottom line is the same thing. The glucose can't get into the cell. And if the glucose can't get into the cell, the cell's going to starve. You need glucose to go into the cell. If the sugar is just floating all around the cell and it's not going into the cell starves. So that's type 2 diabetes. Something's either wrong with the insulin receptor or something's wrong with the insulin, and glucose can't go inside. And the cell dies or starves. So again, let's do a recap. In type 1 diabetes, the body doesn't produce insulin. And if the body doesn't produce insulin, there's no insulin to bind to the insulin receptor. And if it doesn't bind to the insulin receptor, the glucose channel doesn't open and glucose can't come into the cell. So the cell starves. No insulin, glucose can't go into the cell. Type 2 diabetes, something is wrong with the insulin receptor or something is wrong with the insulin. Your body's making enough insulin, or actually it might make more insulin than normal. But if the insulin is defective or the receptor is defective, it can't bind, and then the glucose can't go into the cell. So that's type 2. Remember, type 1, the body's not making enough insulin or making no insulin. Type 2, something is wrong with the insulin receptor or something is wrong with insulin, so it can't bind. If it can't bind, then the glucose channel doesn't open and glucose can't go into the cell. And if the glucose doesn't go into the cell starves. Because if your cell has no mouth, you can't eat the food and then you die, right? If you have no mouth, you can't eat food, you die. So that's type 2 diabetes. So bottom line is glucose is going to rise in the blood. And the reason it's going to rise in the blood, again, this is called hyperglycemia, high blood glucose. And the reason why blood is going to rise in the blood is because normally the glucose would go into the cell to feed the cell. But because you don't have enough insulin or you have defective insulin, the glucose can't go into the cell. And if the glucose can't go into the cell, it stays in the blood. So that's why the blood glucose rises. Now, gestational diabetes is less common because it only happens to pregnant women. And that's why it's called gestational diabetes. Now, it's only temporary because it only happens during pregnancy, but it basically leads to a type of type 2 diabetes. No one knows exactly what causes gestational diabetes, but there's theories. Now, when you're pregnant, you have a placenta, right? The placenta is what connects the fetus to the mother. So the placenta is what feeds the baby and gets rid of the baby's waste products. So the baby's poop and the baby's urine is going to go through the placenta and gets out of the mom. Now, the placenta is also responsible for releasing proteins and hormones. Now, the hormones from the placenta, they actually interfere with how insulin works. So even though the mom might have normal levels of insulin, the insulin doesn't work right. So it's the same thing like in type 2 diabetes, right? Type 2 diabetes is where the insulin is not working right or the insulin receptor is not working right. So that's why gestational diabetes is kind of like type 2 diabetes. So, since the mother's insulin is not working correctly or her receptors are not working correctly, glucose rises in the mother's blood, which is called hyperglycemia again. Now, this glucose, the mom, whatever the mom has, she feeds to the baby. So all this glucose that the mom is having in her blood is going to go through the placenta. It's going to go to the baby. The baby sees all this glucose, right? And there's so much glucose, more food than the baby normally would have. So that's why, when your body has excess food, excess sugar, excess energy, what it does is it saves that energy for the rainy day in case you do starve, right? So your body normally makes fat to save this energy just in case that there is a time when you can't eat. And that's why babies are prone to obesity, because when the mothers have gestational diabetes, their insulin is defective, the blood glucose goes up, the mom gives so much glucose to the baby and the baby gets fat. Now, another reason is, so insulin's job is to bring glucose into the cell. Now, when the baby's pancreas sees so much glucose coming in, it's going to start to make more insulin. Remember, the pancreas's job is to make insulin, and insulin's job is to bring the glucose into the cell. Without insulin, glucose can't go into the cell. So, when these babies get born from moms who have gestational diabetes, they tend to have low blood glucose because the glucose isn't in the blood anymore. It's inside the baby's cells. So they have low blood glucose. Low blood glucose is called hypoglycemia. Also remember, whenever you overwork a machine, it breaks, right? So your body is working overtime. Every time you're eating a lot of food, eating a lot of things, you're having to work extra. Having to work overtime in order to process all this food. So over time, machinery breaks, right? Same thing. So for some reason, you work your machine overtime for a long period of time, the insulin starts to not work correctly. So these babies are prone to developing type 2 diabetes. Now, the result is the same in all forms of diabetes mellitus. The body has too much glucose in the blood, and the cells are starving. So we call this hyperglycemia, which is too much glucose in the blood. Hyper means excessive or over. Gly means sweet or sugar, or same thing for glucose. Cemia means blood. So hyperglycemia, too much glucose in the blood. Okay, so why do diabetics get so hungry? If you think about this, you eat sugar, but the sugar can't get into the cells. Your cells are starving. And you want to make your cells happy, so you eat more and more. So your body fills up with sugar, but the cells are still starving. Because remember, without insulin or with defective insulin, the cell can't eat the sugar. Because in order for the cell to eat sugar, the sugar has to go into the cell. And without insulin or without insulin working correctly, the sugar can't go into the cell for the cell to eat, so the sugar stays in the blood. And if the sugar stays in the blood, your blood sugar goes up. And once again, a recap, type 1 diabetes, there's almost no insulin. And the reason there's no insulin is because your immune system is destroying the cells that make insulin. So that's why type 1 diabetics are usually skinny or start to lose weight. Because the cells are starving so badly, the body tries to break down fat in order to make sugar to feed the cells. But the sugar still can't get into the cells because there's no insulin. So without insulin, sugar can't get into the cells start to starve, the cells panic and go, hey, I need food. The body breaks down fat in order to make more sugar to try to feed the cells, but it still can't feed the cells because the sugar can't get into the cells. Now remember, in type 2 diabetes, the levels of insulin are either normal or high, but something's wrong with the insulin. Either something's wrong with the insulin or something's wrong with the insulin receptor. The cells aren't starving so badly, so type 2 diabetics tend to be overweight or gain weight because people eat more and more, and when you eat more and more, it's kind of because you're trying to feed these cells. But the cells can't eat the sugar because the glucose can't get into the sugar because the insulin's not working. So type 2 diabetes used to be called adult onset diabetes because a person usually didn't get type 2 diabetes until they were in their 30s or late 20s. However, now you're seeing teenagers getting type 2 diabetes, and why is this? Remember, when you start to eat food, it turns on all this machinery to break down the food, to process the food. And what happens when you overuse the machine? It breaks. So obese kids or people are abusing their body machinery. Things break. So the insulin starts to not work right. And when insulin starts to not work right, the glucose in the blood goes up and up because the glucose can't get into the cell, so it just stays in the blood and keeps accumulating. And that's type 2 diabetes. So now, why is too much glucose in the blood bad? First, the cells are starving because the glucose can't get into the cells. But why else? Now imagine you pour a ton of sugar into a glass of water. What does that water feel like? It feels terrible. It feels, sticky. It feels terrible. Now imagine that much sugar in your blood. Remember, your blood's mostly water. Imagine blood full of glucose trying to flow through your body. Now this terrible blood full of sugar is circulating throughout your body, through all the blood vessels. This actually speeds up the hardening, narrowing of arteries. So diabetes helps cause atherosclerosis. It circulates through the blood vessels in the brain, so you can get stroke. It can damage blood vessels in the heart, so you can get coronary heart disease. It can damage blood vessels So these blood vessels are large blood vessels, correct? And that's called macrovascular disease. Now, macro means large, vascular means blood vessels. So macrovascular disease, or disease of the large blood vessels. Now, more importantly, blood full of sugar damages the small blood vessels too. And this is called microvascular disease. And where do we see small blood vessels? Everywhere, but the ones we focus on for diabetes are the eyes, the kidneys, and near the nerves. So you've heard of diabetic complications. So what is a diabetic complication? It's basically a byproduct of some process. So a diabetic complication is a byproduct of diabetes. Now, diseased small blood vessels in the back of the eye, it causes leakage of proteins and blood into the retina, and this can cause aneurysms, spontaneous bleeding, which can lead to retinal scarring, detachment. So you get blurred vision, you get blindness. So they're also predisposed to cataracts and glaucoma. So this is called diabetic retinopathy. So retina refers to the retina of the eye. Pathy means disease, so this is disease of the retina or disease of the eye. So when the small blood vessels of the eye get damaged, you get diabetic retinopathy. When the blood vessels of the kidneys get damaged, you get leakage of protein into the urine. And later on, the kidneys lose their ability to clean the blood. So eventually, you're going to get accumulation of toxic waste products in the blood, because normally you would pee it out. But without the kidneys working correctly, you're going to eventually need dialysis. And so this is called diabetic nephropathy, which is disease of the kidney. So diabetes can damage the small blood vessels of the eyes, which is diabetic retinopathy. It can damage the small blood vessels of the kidney, which is called nephropathy. And a big one for our company is diabetic neuropathy. So neuropathy, neuro refers to nerve, and so neuropathy is disease of the nerves. So hyperglycemia can damage the small blood vessels, which is called microvascular complications. Now, hyperglycemia will reduce blood flow to the nerves, and the nerves become damaged or die because of lack of blood. Because remember, blood is carrying the food, blood is carrying the oxygen. Without feeding the nerves will start to starve and die. You know, nerves are cells too. Nerves are made of cells. Now, whenever you feel something like a sensation, you're either feeling something like pain or euphoria or things like heat and cold, it's because the nerves are sensing something. So when you think about what happens when you haven't eaten in a long time. You start to get dizzy, you get confused. Now think about the nerves not getting food. They start to act weird. So patients with diabetic neuropathy, they can feel weird sensations like numbness, burning, aching. They just start feeling weird things because the nerves are starving. And if these nerves start to die, they stop feeling things altogether, which we call loss of protective sensation. So again, without insulin, the glucose can't get into the cell, so the cell dies. And nerves are made of cells too. So if the nerves can't eat food, can't eat glucose, the nerves start to die. So you can lose protective sensation. You can lose feeling at all. And why is losing feeling bad? Because imagine you stub your toe. Normally when you stub your toe, you feel it. You go, ow. And then what do? You do things to protect your toe so you don't hurt it more, right? You stop stepping on it, you rest it, you relax it. So people who have diabetic neuropathies, they might not be aware that they're hurting their feet. And if they're not aware they're hurting their feet, they keep hurting it. Like if you can't feel a sensation in your feet, you don't feel the pain, you might like jump on it, or you might run on it, or do something that causes more damage. So if you keep doing the same things over and over with that damaged part of the foot, you can develop things like sores or ulcers, which makes it worse. Now, nerves aren't only for sensation. Nerves are also important to cause your muscles to move. Now, the muscles of the foot might not work properly because if the nerves aren't working properly, you're going to lose sensation, or you're going to have altered sensation, meaning your nerves start feeling weird things, or the muscles that depend on those nerves. So if the nerves don't work, the muscles don't work properly. So this might cause too much pressure in a part of the foot. The muscles don't work properly, the foot doesn't align properly, you get too much pressure in a part of the foot, So you get foot ulcers. And that's why about 10% of patients with diabetes will get foot ulcers because their nerves aren't working properly in the feet and they're not feeling sensation, so they damage their feet further. Now imagine blood. Blood is life, right? Blood carries your oxygen, it carries your nutrients. Think of blood as the freeway so things can move around your body very fast. Now imagine your blood is full of sugar flowing through all your blood vessels. It's damaging your blood vessels as it moves through them. Now if the blood vessels get damaged, that means that area of the body will get less blood than it normally gets, right? The blood vessels get damaged, there's less blood going to that area. And your peripheral extremities, like your feet, your hands, they already get less blood than the core of your body. So if you damage the freeway, it's harder for the blood to get around and the cells get less blood, so the cells are starving. The cells are already starving, right? Because insulin isn't around or it's defective, so the glucose can't get into the cell. So the blood vessels are damaged. That means that area of the body gets less blood and there's less food, less oxygen, less everything. So the cells start to die. And that's what gangrene is. Gangrene is a bunch of cells in an area that dies.